minutes. Tracy Edwards is from PCS Union. Tracy, welcome, and the floor is yours. Thank you.
Thanks very much. Good morning, everyone, and good morning to everyone who's joining. My name's Tracy Edwards. I'm a full-time officer for the PCS Trade Union, which represents civil servants, museums and gallery workers and outsourced workers across the civil service and national government buildings. And I'm currently the full-time officer with responsibility for health and safety. The first thing to point out is that trade union health and safety reps have been at the forefront in terms of fighting for safer workplaces. But what's been clear is that the pandemic has brought into sharp focus how little regard is given to the health and safety of workers wherever you work. You know, if you're working in if you're in the workplace or whether you're working from home. Now, the Health and Safety at Work Act was brought in 1974. And there was management regulations that stemmed from that were won on the back of a number of workplace tragedies and fatalities. And it was workers in those industries and in those situations through their trade union, through collective action, that secured these rights. And the Health and Safety at Work Act is still primary legislation, and it still forms part of our rights. But you fast forward 40 years and we see a complete disregard. Effectively, government and employers are being allowed to break the law, in my view. Now, what do I mean by this? Well, refusals of employers to consult with safety reps on safety measures, number one. A haphazard and disjointed, or sometimes, in a lot of cases, no approach towards risk assessments and assessing the risks in the workplaces. And as Andrew has explained, not applying the hierarchy principle in terms of implementing the necessary safety controls that are needed to make sure that our workplaces are safe. And this has been done with the collusion of the government, because these employers have effectively been hiding behind government legislation and unfortunately as well, public health authority guidance. Now, one case study for us to all look at would be the situation at the DVLA in Swansea. Since last year, the union has raised a number of concerns around safer working, with 2,000 staff on site working in call centres, etc., etc. We have a management team there who have absolutely no understanding of health and safety. And as a result of their actions, we've seen approximately 600 positive COVID outbreaks in that workplace since last September. The management has refused to take the union concerns seriously. They've refused to recognise the role that airborne transmission plays, which is contributing towards an increase in community infection rates across Swansea and South Wales, yet no enforcement action has been taken against them, and our members have been forced yet again to take another period of 4 days strike action as a result. Now, this is really serious, because this is a refusal by a major employer in that area to recognise the role that they play in contributing towards infection rates. And what they've been doing, like most other employers, is that they've been blaming individuals, they've been blaming their young workforce, saying that because they're all younger, they all like to go out, they're all outside breaking rules, of course, not helped by the mainstream media. And they are the ones who are bringing the virus into the workplace. And scandalously as well, when the union was advocating that as many staff as possible should be working from home, the management there started threatening them and saying that if that is the case, we will privatise those jobs. Now, that's just one example, and this is unfortunately the picture on a wider scale. We've been inundated with queries from our reps, who are merely asking employers to implement basic health and safety rights in their workplace. There is such a resistance from employers that this has resulted in a number of disputes over the past year. But where we are strong, with unions and management willing to work together constructively with trade union safety reps consulted properly, has resulted in less problems and safer workplaces. And I hope that the panel can agree that this is something that we would all want to see. But again, this crisis has more heavily impacted on those in precarious jobs, those from a BAME background, disabled workers, women, and in jobs such as security and facilities management, and those towards what we are finding in our union is those towards who are, the lower grades members of staff generally tend to be the ones who are being told that they have to come into an unsafe workplace. We've got a situation this Monday where the Department for Work and Pensions are forcing hundreds of their staff back into the office, despite the fact that 3/5 of them feel unsafe. And it's not just that the risk of catching COVID, it's the stress, the mental health impact, the issue of long COVID, how sickness and attendance management systems are going to be dealt with. It really is a ticking time bomb on a social, societal scale. And if we don't sort this out, it's going to have a devastating long-term effects. Employers are now looking at how they can use new technology and IT to develop hybrid models of working. This isn't because they have suddenly developed a caring attitude towards home working, allowing their staff the flexibility that staff always wanted to have to manage their own working day. This is driven by productivity. Before the pandemic, only 5% of workers were able to work from home. Now that figure is closer to 40%. However, as we see from the example at the Teleperformance in Airdrie, employers will be looking to install new technology to monitor staff, and in PCS, the threat to close offices is looming large. The workplace has completely changed as well. It's completely changed for everyone, and it's not been something that we've had any control over. There is a huge amount of work to do to address these issues on making workplaces safe, or your place of work, whether that be in a workplace or at home. These are basic and fundamental rights, the right not to be made ill as a result of going to work. And this is completely being undermined by employers, by the government as well. To finish, 150 deaths so far, multiple outbreaks in workplaces, care homes, etc. And it's taken over a year for the Health and Safety Executive to publish any sort of recognition or guidance on the role of airborne transmission. Now, it's something that we've known in the trade union movement for months, is that airborne transmission of the virus is the #1 risk factor in an indoor setting. It's a scandalous state of affairs. Workers have been subjected to change after change, government incompetence. Who remembers the track and trace debacle? And now no end in sight, really, and who knows, again, we could be facing a third wave in the autumn. These are legitimate concerns of workers in Scotland and across the world. Zero COVID campaign have been absolutely correct in arguing for an alternative strategy. But my question to the panel is that, do you agree that the situation that I've just outlined, and I could go on for hours about this, but I've only got 5 minutes, but do you agree that the situation that I have outlined is absolutely disgraceful, that we need urgent action to tackle this, to make sure that employers are held to task? Not one employer has been prosecuted as a result of all this. And what will you do if elected to work with trade unions and to change this situation, not just now, but for the longer term? Thanks very much.
Thank you, and thank you, Tracy, for the question. It's very apt. And as somebody who lives around the corner from a call centre, one of the largest in Glasgow, I know from the early days of the pandemic how difficult it was to get Sky and other companies to actually shut their call centre, which wasn't compliant with the regulations. In some cases, we had building companies who were building because the English regulations they were following, they didn't realise they had to follow the Scottish regulations on building sites here. So it took us a couple of weeks, actually, as the council to actually close them down and to get them to obey the law. But the trouble is that the Health and Safety Executive did not have either the powers, the staff, or the will to do it, because the UK Tory government that Pam is fronting up for today has cut its budget massively during the period of austerity we've just gone through, so that there's hardly any inspectors. So effectively, councils who are already hard pressed and who have very few resources for environmental health officers to go around to factories were left with the entire burden. Police wouldn't come to factories to arrest factory managers or leaders to stop them breaking the COVID laws, yet they were quite keen to go around parks to rustle around people with a can of juice in their hands to get them out of a park. Well, I think the correct thing would have been to use the resources for the Health and Safety Executive to properly shut these factories down. It took us a couple of weeks to actually get that to happen. So I know from experience how workers felt vulnerable and insecure at the ability to actually use their rights at work to enforce the distancing things. So it's pretty clear that our health and safety laws don't work properly, and it's pretty clear that they need to be toughened and strengthened. And that's one of the things I would commit to, that clearly we need these powers at Holyrood. So we need health and safety law devolved to the Scottish Parliament. We also need employment law devolved to the Scottish Parliament. That will allow us to actually control what's happening to workers and give them more confidence. And the regime needs to be designed with workers and with trade unions, co-designed, because as you say, nothing about us is without us. And as a trade union, I think you can trust that as a member of the Scottish executive of the MU here, I am a trade unionist in my bones. I've led strikes on health and safety questions when I was on the underground. So, I understand why health and safety matters are such an important thing. And we know from the underground, from railway working, that diseases are transmitted through airborne transmission in public spaces, which is why there was a resistance to London Underground for decades to us wearing masks, because they thought it was a bad image to give to the public. It would make the public feel panicked, whereas of course in countries like Japan, it's normal for railway staff to wear masks. So this is a long time issue that bosses, public organizations, public bodies have always tried to ignore the health and safety issues of workers. And the pandemic has only just shown that much more in sharp release. But then you have the ignominy of PPE not being widely available, and then the UK government handing out contracts like sweeties to its mates to then produce stuff that's actually rubbish and not fit for purpose and cost billions. Really, the culpability of that government and that ridiculous man with the ridiculous haircut, and I would say that, wouldn't I? That ridiculous man is responsible for the murder, pretty much, of 130,000 people who didn't have to die. If they'd shut down the borders, if they'd done a proper lockdown, if they hadn't helped to buy one of those stupid schemes to resuscitate the capitalist economy rather than save the people's lives. We have been tied to a four nations approach led by a person who was so brazen in his negligence that he went round without a mask for most of the event until he got it himself. He had to get it himself and nearly die before he got it. Now, it shouldn't have to take yourself getting the disease for you to understand how deadly this thing is. So I'm reminding everybody just how bad this was. And we've been one of the worst performing countries as a UK in the entire planet on this question. So although we've done a better job in Scotland, there's no way we can be complacent about that. We perhaps have had half as many deaths as we might have done if we didn't take the measures we did. But we're still not been great because we have not controlled borders. We've not controlled workplace transmissions. And one of the key things about workplace transmission is about ventilation of spaces. And this is one of the reasons why I've been worried about schools and colleges returning, because I do not believe that our ventilation systems are fit enough for purpose to make these spaces safe to allow mass participation in them. I hope I'm proved wrong now that we've reopened. But if that's the case, then we will have to close those institutions again and stop community transmission. There's no level of transmission is acceptable to me personally, and I think just anybody who understands how this works. So if I'm in that parliament, I'm going to be fighting for more health and safety legislation and more rights for workers at work, but I'm also going to be fighting for ventilation systems to be paid for and to for workplaces to be made fit for purpose.
Thank you, Graham. Thank you for your answer. I will take next Paul Sweeney from Labour Party. Thank you.
Thanks. I thought Tracy's account was pretty harrowing, in terms of the consequences that we've seen play out. But again, it's just another example of exploitation brought into sharp focus. This is not something new to many workers in precarious employment or in exploitative employment. And, my own family's experience, my mum got COVID this time last year. She works in a bank in a customer-facing environment. She wasn't allowed, the bank stayed open throughout the first lockdown. And she cohabits with someone who's was shielding because they're asthmatic. So you can just see the risks right away in that situation. So she wasn't able to remove herself from an extremely risky environment at that point. And that's the case of millions of workers across Britain have been faced with that situation in the pandemic. The lockdown didn't mean anything to a lot of workers because it's one thing if you're working in a white collar job with a secure salary and you can work from home. But it's another thing if you're a blue collar worker having to physically go to a place of work and you're facing significant risks. And we saw that within the NHS. We saw it within other frontline jobs that require physical activity in a workplace setting. You can't substitute it for remote working as easily. They're generally lower paid jobs, and they're generally highly risky in terms of health and safety. And you're right that the government played fast and loose with this, partly because they were poorly prepared to start with. We've seen a decade of austerity hollow out this country's capacity to be resilient in the face of unexpected shocks. So we had these exercises carried out, simulating what might happen in a pandemic. None of the recommendations were implemented. There was no stockpiles of PPE. The stuff that was out of date. We had, frontline NHS workers using face masks that were, rotten, that didn't protect them. They were wearing bin bags. When we saw in other countries, they were wearing, almost fully, sealed suits, etc. So, it was horrific to see the level of death. So the point's true. Thousands of people have died unnecessarily, and that's a criminal act. Not only have we seen a failure to enforce current legislation in the workplace, because again, a lack of capacity to do so. I don't think we've seen an appetite from the Criminal Justice Authority in this country, Lord Advocate, to explore ways in which we can ensure that employers are held to account for their negligence, probably because it would affect public sector actors as well as private sector actors, and there's an element of self-preservation there. But also, I think there's not been an effort to sort of look at how we can reform using public health legislation in Scotland. So I think that's something I'd like to take forward in the next Parliament, working with the trade union movement, to see how we can seriously hold government to account at all levels for their failure to not just legislate competently to protect workers in vulnerable environments, but also to enforce the current legislation and restrictions, and also looking at the way things have been pressure from people to get people back into education, is like Graham was saying, is putting teachers at risk. So that's something, for example, that we really need to look at. That there's competing pressures politically that are harming workers, and we need to have their trade unions' voices heard loud and clear in the Parliament.
Thank you very much, Paul. Thank you for your answer. I'm going to be taking now Pam from the Conservative Party.
Thank you, Carmen, and thank you, Tracy. I am totally with you that no employee should be going through what they've went through. And if a place, has, at the end of the day, if you're going to be asked to come into work, it has to be safe, not just for COVID, but many other areas. And this is where I can tell you, in a former life, that I'm an ex-trading standards officer. So I was basically going out, and we're working with health and safety quite a lot as well, making sure that businesses were compliant. So I think that, yes, there is a lot to do there. But what I also, I've been hearing from others is, and, Graham's very quick to jump on the fact, let's blame Westminster for everything. But I think what he needs to understand is there's £23 billion given to for this pandemic. So there was some onus at the end of the day and responsibility on the SNP. The SNP do nothing and everything was done by Westminster. That wasn't the case. So they had lots of opportunities. But in relation to health and safety, Tracy, what I would say is, and I've worked with businesses for 15 years, and I think there's a couple of things that we could look at. Now, trade unions are very important, that we need to make sure that when we're working with businesses, there's something the Scottish Conservatives have put out in their manifesto, that we want to establish a business recovery council group so that we can actually reach those businesses, not just to say that how are they, do they need loans, or how's the furlough scheme and things like that, but other side as well, to see that are they compliant, what is it that they're working with, and what do we have to say to them now after this pandemic in Scotland to say that basically, you need to put this in place, you need to keep these people safe, and you need to do this. So I think there's some guidance and certain things that I'm happy to work with, obviously with the trade unions to put forward, but we need to make sure, rather than imposing, and you've said this, it's been imposed and some of them aren't following it and things, we need to make sure that we can go through certain organisations, even like the Federation of Small Businesses, Chambers, we've got so many great organisations, and I think this has to be a collective approach that we all work together to make sure that these businesses are compliant and that these employees are not put at risk. Now, another area that was touched on today, we talk about councils. Now, I just mentioned earlier on, I'm an ex-trading standards officer, so it's very important that our councils are fully resourced and funded. This is an SNP failure. You know, the money has been coming into them, and that's something that it's unfortunate that the councils, local councils, and I know from my local council here, they can only do so much. Yes, they can send people out in inspections, but the resources are needed. So I think this is a collective approach that we all need to do a lot more, not just Westminster, but SNP, Scottish Government here, and also, you know, all my colleagues here that have been on from other parties have mentioned that they want to back this and do this. I'd be happy to work as a cross-party group to make sure that, Tracy, people's voices are heard and that we're making sure we can implement. So I'm very happy to help with everything. And I think we've got a lot more to learn, but also a lot more to implement as well. Thank you.
Thank you, Pam, for your response. I would like to just remind people that they can post questions in the chat, but it would maybe better for candidates to just to focus on the question that you put initially, so everybody has the chance to answer the question that was put to them in the first place, and we can come back to other questions later on at the end of the event if that's okay with everybody. So next, it would be Maggie for the Green Party.
Thanks very much, Carmen. And Tracy, thank you for giving such a clear statement around the complete and utter failures of employers to deal and of the UK government to tackle this. I'm quite astonished by some of the things Pam has just said, but I'll maybe leave that for later. I'm an active trade unionist. I have been all my working life, including as a health and safety rep, and I'm currently responsible for the health and safety in the charity of all of my colleagues in the charity that I work for. So the last 15 months has been a really, really tense time in many ways, because I am very aware of the burden of responsibility that I carry, not only to ensure my colleagues' health, but the well-being and safety of their families and wider communities as well. I also want to say very clearly solidarity. I extend my solidarity to those who have been and are on strike. You know, to tackle poor paying conditions, to tackle some of the horrendous abuses of power that employers have enacted against workers. So solidarity with those all workers, and I know the Scottish Greens stand alongside them. Unfortunately, as Graham and Paul have outlined, some of the powers that we might wish to have over health and safety aren't held by the Scottish Parliament. But I think, you know, there are arguments that we can make around the powers that we do. Back in 2014, I did argue for all employment law and health and safety law to be devolved, and was told no by Labour instantly. But, you know, we know that the UK government is hostile to health and safety, and we desperately need a preventative approach that uses the government's power to prevent spread. Instead, we had Eat Out to Help Out. We had Go Back to Work or Lose Your Job, and other really, really terrible and discriminatory approaches, I think. The Eat Out to Help Out scheme also put hospitality workers and their communities at risk, not only those who took up that scheme and went to Eat Out to Help Out. I kind of hoped, maybe beyond hope, that we would have learnt from the Cheltenham races or the Liverpool Atletico Madrid football match and other delays to implementing lockdown. Instead, I think it showed that there was no clear learning from any of those outbreaks, those spreader events. There was no care about the population coming from the UK government. And I think it was a Daily Telegraph columnist who stated that we should just let the virus clear out the older segment of the population, reflected the government's position, quite frankly. There was a complete failure to plan. Instead of planning to stock up on PPE, they bought body bags. And I think that mentality just shows where the Conservatives are coming from. I think it's bad. That approach has been bad when it's about citizens, but I actually think it's homicidal when applied to the actual government employees, like those who have lost their lives at the DVLA and elsewhere. You know, I think if we can put legislation in place imprison people for 10 years for removing a statue of a slaver. We can put legislation, we can ensure we enforce the legislation that is there to protect workers. If we can waste £37 billion on a dysfunctional track and trace system, we can afford to pay decent sick pay and proper protection for workers. And the government's failure to do those things, I think, is an outrage. In many ways, I think COVID has been a canary in the mine for poor employers. Meat packing, that Graham mentioned, is a good example, and call centres, as we know. So, we need to make very, very clear that our recovery has to have a fair deal for workers as an integral part of it. At the UK level, I think that includes raising the minimum wage to establish a real living wage, including additional protections against wage theft, expanding this coverage of statutory sick pay and increasing it so it pays at least the real living wage. People shouldn't be forced to go back to work when they are still unwell simply because they can't afford not to. For as long as we are in the UK, Greens will seek the devolution of the powers I've been talking about and issue a formal request to UK ministers to make this happen. We want to use public procurement to require firms to recognise trade unions, because we know that trade unions can secure better pay and conditions and better health and safety standards for their employees. And I think we need to acknowledge also the huge pressures that our health and social care workers have been under, and these workers already, like those in retail and elsewhere, putting themselves at risk to look after that. So we need a proper recovery plan for them too. It's about planning effectively, and we just cannot trust the Conservatives to plan in that way. Thank you.